Welcome everyone to this month's Fireside Chat hosted by Digital Square. If you're new to Digital Square, we work with innovators, governments, and donors to support digital health programs by supporting adaptable, interoperable tools that are designed to work together seamlessly. One of the ways we do this is by supporting events like this. So welcome. The house rules for our Fireside Chats is these are meant to be open question and answer sessions. Please bring your questions, come off mute, jump in, ask Jose whatever you need. I'll ask that if you're not speaking, please do mute yourself so we can hear those that are. We have a Google Doc if you would prefer to have your questions typed in. I will be monitoring that and we'll be reading those as well. Feel free to also throw questions in chat. We'll do our best to get to everything. There are also some resources and past webinars in there if you are interested in seeing what else has been done. So without further ado, I will turn it over to Jose, who is a data management standards and interoperability expert. And since 2009, he has been contributing to global healthcare standards, HL7, IHE, and ISO. He's also facilitated the launch of HL7 and IHE work groups in Brazil, Portugal, and Belgium. So I will turn it over to Jose.
Veranda. Hi everyone, just saying hi and switching off my video because I'm actually at home and the person that's with me that does not give me her explicit consent to share my video. So let's start. So today I might have some background noises. I hope you don't get distracted with it. My apologies for that. Yeah, let's start. These are informal chats that we have. So I expect that we have some questions, some topics, some pain points as you're going through FHIR. Maybe you have seen some of our FHIR webinars and you have some questions about those, or something that triggered your thoughts. And this session is exactly for us to align there and to see what can we improve on our trainings, or any points that you want to discuss, or any general discussions. So first question, does anyone have any starting points, any opening questions, any things that you want to bring to the group? If not, I might be interested in first of all, in recapping some of the topics to see if that triggers some ideas, or asking some of you what are you busy with, what are your preferences, and then we can explore from there. This is indeed just to set up a dialogue. These sessions are really just to set up a dialogue. So we have been discussing some FHIR implementation aspects. The last thing we've seen is how to get analytics. So in our webinars, we have how to get analytics running on FHIR. So we have explored from the tooling perspective, but also from the functional and business perspective. So that's one of the things that we have that I would like to start bringing. Though, so in terms of case reporting or analytics, we have we had some discussion recently, a few weeks ago. And it would be, I don't know if any of you has been watching those webinars, and if the analytics thing and data extraction and reporting, if that's something that appeals to you. So I'm starting backwards. So I'm starting with the latest webinar that we did, and see if that brings any ideas. Otherwise, we go back all the way down to the FHIR Foundation if we have to, or any specific topics. So has anyone of you joined those sessions? The last one specifically on analytics. Okay, I take the silence as we haven't, or we don't want to talk about it. So this while I'm trying to get my things together, because I have a couple of interactions here that I should not be having, and I apologize for the awful timing. Let me then plan B. What are you working on? So what are the things that you are busy with around FHIR that you would like to share? I don't want to put anyone on the spot yet. I would ask some of you in the order that I have here on the screen. But if someone wants to speak up, please. Otherwise, it's just difficult for me to pick up a topic. It will be very random, and I don't know if it's useful. So, Wendy, thanks. Don't have to apologize for the silence. When you say this is a newer topic for me, we're here to learn. We are all here to learn. I'm also here to learn. And I'm curious to, when you say this is a newer topic, I'm curious to see what is this? Is it the whole FHIR? Is it interoperability? Is it whatever ideas? Sorry, and I would like to really keep exploring that. So please bring questions while I try to silence my background symphony. I would really like to have your some input. This is really an informal chat, so I would like to have any thoughts that you are suffering with or exploring. If we don't have anything, I can start, for example, for Wendy. She's new on, I presume new on FHIR. Then we can start there. Like, what do you have to do if you're new on FHIR? And any of those things, those are all valid topics for us. So someone please break the silence on your side while I try to make some silence on my side.
Well, while Jose tries to make some silence, it sounds like we've got a few newer folks. Would you all be comfortable just either typing into chat or saying out loud what you're working in the space or what brings you to this chat? So we get a sense of what the needs are here today.
I can start. I'm Wendy Leonard. I am the Executive Director of TIP Global Health, and we created EHESA data solutions in Rwanda. And we've been really working on the tool itself, but now at the process of really focusing on interoperability. And so we've been talking about FHIR a lot, ready to go with being a part of the process of utilizing, thinking about how we adapt EHESA to the FHIR standards, but then also how to become a part of the community as well. And I'm sitting in for our CTO, so I'm not the person that has the expertise as much as Adam is. So
perfect. That's great to hear that you're thinking about and integrating into FHIR standards. Anyone else want to introduce what they're working on? What brings them here?
It's Daniel here from PSI. I'm happy to go next. You can hear me okay?
Yes.
Yep.
Yeah, so like Wendy, we are like new to FHIR. We had heavily invested in DHIS2 for a long time for our sort of MIS side, and then we went more client facing. So we had sort of more direct client interactions, implemented things like OpenMRS and but then also sort of bots and e-learning that was sort of directly client interfacing, and realized that we sort of tried to shoehorn everything into there. We looked at FHIR at the time, a few years back, and we didn't dare. That was a mistake. And said, okay, let's try to shoehorn this into the backend structure of DHIS2. We couldn't cope with it because it's not meant for this bombardment of interactions for every single sort of transaction you put on a chat. So so we had to build in our own backend based on sort of unstructured sort of MongoDB approach. And now we're changing everything towards FHIR, the FHIR backend using Happy, but we also have now the still EMR systems there, but we also refer clients into services. So that should probably be already on the FHIR standard. So then we realized that some tools now like OpenMRS and DHIS2, they have FHIR compatibility, but they don't even have changed the backend architecture. into it. So, and as Wendy said, the big driver is for us, of course, interoperability. We want to get away from focusing on a product, but more focusing on the standards and the interoperability around, so that we can better assist local governments as well as a local private sector sort of in their tools in the digital tools and more concentrate on using FHIR's interoperability. Yeah, that's where we are, and we are pretty much at the beginning. So I just here always to learn what others are doing, with whom we can talk, and hear what is new in the FHIR side. So yeah, that's where we are. So I'm not an expert. I'm just listening in at this stage. Thanks.
I don't think any one of us here are experts, but thank you for sharing. Is there anyone else comfortable sharing what they're working on?
I see Bengo has shared his
Yes.
perspective.
Thingy, would you mind coming off mute for a second and telling us what you're working on, or what kinds of interventions you're working on?
Hi, good afternoon, good
afternoon.
morning, depending on the time zone where you are. So my name is Bengo Nyuka. I'm a senior digital health advisor to the Ministry of Health and Social Services based here in Windhoek, Namibia. I'm spearheading the implementation of different digital health interventions. And one area that we are focusing on is integrating the different systems. And I'm new to FHIR, and I'm trying to see how we can be able to benefit out of it to ensure that we have a robust interoperable layer that will be able to support these different systems, exchange information. So I'm here to learn and also see some of the cases where FHIR has been successfully implemented for me to learn even future collaboration. So now we can be able to go about interoperability initiatives. Over. Thank
you, Bengo. Any other takers? It's good to hear that Namibia is working on interoperability. Anyone else want to introduce what they're working on?
But I can actually take it from there. So what I hear, and feel free to interrupt or tell me if what I'm saying is not relevant for your purpose, but I just wanted to launch a few ideas here, because this is supposed to be a lively discussion on any topics that we prefer. So there's a couple of things about getting started on FHIR and about getting started on standards. And I have actually had an interesting discussion yesterday with some health experts that they wanted to also check what can standards. So basically, the discussion is what can standards do for healthcare, and that's, first of all, as a technologist, that's also my focus. It's not about the technology; it's what can it do for us. And there, I think there's some knowledge to be shared and acquired. So even before I go a bit into the FHIR techniques and technologies, there is a lot that is behind this. So when we do standards, we are indeed focusing on interoperability, by the single reason that if we do FHIR, so if we want to have interoperability, so if we want to make systems that don't become data silos, if we want to do that, then the best way is to start having them talk a common language. So to have common data definitions, to have some common even technology platforms. So that's how we make sure that, for example, if we have a patient that's being treated for one disease in one location of my country, then when the patient has a follow-up for another condition, for an accident in another part of the country, in another institution, then we don't have to duplicate the data entry, or that we can keep track of the patient throughout the treatment life cycle, or the patient cycle of care provision. So if we start with that, with that perspective, like standards are there just to help us create systems that connect better to each other, then I think we have a good segue for entering into FHIR. And FHIR is, as you possibly have seen it, FHIR has taken the interoperability world by storm, I would say. So it's a new standard, but it just uses so many good things. I would like to mention a few of them. So many good practices that have been doing interoperability for quite a while. We have been suffering so much because those things were not there. FHIR has given us so many tools, so many reasons to use it, that it really has very good. So there's a very good rationale for FHIR to be taking the world so fast. So let me start here and say the way that I see it. So FHIR is a technology standard. So technically FHIR is a technology standard, but the way that I see it, FHIR has been defined from the ground up as a standard that is built by the community of implementers. So there's lots of knowledge by consultants, by vendors, by everyone. Everyone has brought their knowledge together to build a standard together. So to put something together, it has first of all, it relies on technologically. It relies on modern technology. So it allows us to do REST APIs. It allows us to do some funny things about GraphQL, so querying data. It does provide standard ways to exchange data in the sense of, if you have a RESTful API, which most modern applications would have nowadays, FHIR says, sure, that is one way to do it, and here's the standard way to do this. So here's the standard way to do search. Here's the standard way to do, for example, a request for devices or a request for medication. Or here's the standard way to document patient information. So FHIR has done that, and without making this conversation all about how FHIR works, I would actually start by sharing, maybe I can share my screen on a couple of things that we have those links there. Let me share my screen. Where is my screen? Sorry, silly question. I know where my screen is. It's right in front of me. I wanted to ask where my screen sharing button. So, because of the immense amount of things that FHIR can cover, I'm just going to mention a few of them. We have some introduction webinars. So Digital Square has provided some webinars where, if you want to see the FHIR basics, or if you want to see how FHIR works with terminologies, or how FHIR works with analytics, or a number of topics that are not full trainings, they are just introductory trainings. If you want to start feeling comfortable about the FHIR technology and how it fits into the overall structure, these might be a good place to start. So they are available, the videos and the slides, they are available for you. And I would ask Frunda if you please share the link in the chat while I'm displaying this and the rest of the stuff. I can also put the links in the never mind, I will do it. So this link here that you have on the chat has our webinars. Second, what is FHIR? So FHIR is a technical standard. It is documented like this. So this is not about, so this session is not about the technology of FHIR, but if you go into the FHIR website, so hl7.org/FHIR, you will see that this is the currently released version of the FHIR. So FHIR has a formal release process. You have some information like for executives, for developers, clinicals. This is, of course, information that is intended for those audiences, but it's still a technical standard. So it's not something that we can look at this and make a very, very abstract summary of this, because it is a technical standard. So there's things about the foundation, how do you do the base technology of FHIR. There's also the webinars where we try to explain a bit how it fits. And this is actually the technical documentation of FHIR. For example, if I want to see what a patient looks like, or how to exchange information about the, let's see if I can see patient. Yeah, so if I want to see what is the patient data model from FHIR, this is what it looks like. So you see FHIR, and this is what FHIR does. So FHIR defines how to represent some key data objects in healthcare, and how you can exchange it. Because once this grammar is correct, so once the what you mean and the so what the the semantics and the grammar, they are common. So if I have a system that does cardiology or so some tests, some cardiology tests, and I have another screening that does eye screening, they will have not many common data among them, but the patient data might be common. And this is how you, and if you share it like this, then you know that they will understand each other. So I'll add a business layer around this. So I'll add something about this, but this is what FHIR does. And then it goes all the way down to the technical details of this. How do you use this? How do you put this? How do you put a patient together with a cardiology report if you have to? How do you put this together with a medication request or with a surgery procedure? How do you put workflows together? There is all those technical guidance. All that technical guidance is in there. And this is, in a nutshell, if you're starting with this, this is FHIR. And this you can get on our webinars. If you want to start sharing, so if you have a team that you want to see, I want to get as much information as possible. Here's a pretty useful link. So HL7 has been, so HL7 is the creator of so the organization that's behind FHIR. They have been very much invested in keeping HL7 FHIR an open standard. What this means is that, for example, unlike ISO, which is behind the paywall, and it doesn't mean that it's good or bad, it just means that it's a different model. FHIR is an open standard, so everyone can access it, everyone can open it, there are no royalties. And not only the standard, there's a bunch of tools that the FHIR community has been exposing as open source, and there's a real push for open source, even copyleft licenses or licenses that you can do software, and you can even sell it. So you're not obliged to keep things free. So it's really a permissive license, and really enforcing, encouraging the development of more and more open source solutions. FHIR has that openness commitment. And here's this link that I just sent. It's a pretty comprehensive list of materials. So there's a lot there. So all the materials that FHIR community produces for internal meetings, for webinars, etc., they are there. Normally you would do this if you're really into the weeds of FHIR, but it's out there, it's open. So everything that the community publishes, it's always a good candidate for FHIR. For example, we just heard now about the Happy FHIR solution. That is one open source reference implementation of FHIR. It's there. So there are lots of tools. If you're using Java, if you're using Python, if you're using .NET, if you're using Pascal, regardless of where you sit in the technology perspective, there is likely something for you to start using FHIR, for you or your teams. So FHIR has that commitment to have those things out, those solutions out there. Another important resource is the chat.fhir.org. So we have it's a really big community, and if you want to engage with someone and say, hey, I'm starting, or I have a problem with terminologies, or can we have value sets that are in multiple languages? In my country, I have multiple languages. Can I use codes that have the same meaning but in 2 different languages? This is always a great place to ask those questions openly. So I would like to still focus on two things. One is the question on security and privacy, and the other thing is the more business aspect of this. So FHIR being a technology standard, what can we do with it? I think that is one of the most interesting discussions, because I have the feeling that many business managers are being kind of invaded by with the idea that FHIR is the way to go, and at some point someone takes that decision, and it's really hard to explain it, to say there's a business purpose behind it, or to challenge in some parts. So as a strong advocate for FHIR, my personal opinion is that what matters is that it works. Second priority is that it works in FHIR. So in the sense of, if there's something that works, if there's no need to change it, it's not because it's a cool new standard that we should do it. And there's a couple of business. So besides this, there's a couple of business drivers that we can look into FHIR for helping us. So FHIR is a standard that is very complete in the sense of it's not only the technical format, it also helps us do terminologies. For example, the multiple languages thing. It has lots of tooling that you can play with FHIR. You can make prototypes in a relatively easy way, or the teams can pick it up and you can prototype solutions in a relatively easy way. So from a business perspective, FHIR is, while it is a technical standard, it brings a common data model, let's say, for data information, for health information exchange. And that's extremely useful, meaning that if you are going to make a solution, you will need to say, well, what is patient? And for example, do we mean patient gender or patient gender identity? Those are those different things? Well, they are for us, maybe for other countries they are not, but for us they are. Okay, let's consolidate that. And that's exactly what FHIR does. So it allows us to save lots of discussions that we would normally have across business analysts and functional analysts. And it does set up this base. So 80% of the work that we have to do in a country, it's already done for us. And I can tell you with experience that if I was just talking to a colleague the other day, he says, I want to make an allergy of databases and I want to see what's the prevalence of allergies in the country. And I just told him, good, give me 15 minutes and I will give you a backend with a server that you can use as a backend for that, and you can start putting data immediately onto this. It is that simple because we have agility, we have open source. So FHIR does that. So from a technology perspective to the business, this is one of the value that we deliver, is something that is ready in the sense that we can prototype with this rather rapidly. There is no 3 months of starting to think what would be the data models, plus 6 months to even consider the first implementation. So it's really something that we can use all those technologies with the intent of accelerating our implementations. So that's one thing. And before I go into the privacy, the other thing is that FHIR also is more and more evolving into enterprise architecture thing. So how can I explain? So if you have a project, you don't have the requirements like we need the patient data object and we need the medication request data object. You don't have that. You have maybe a business need, say we need to do population analytics, maybe focusing on HIV or maybe focusing on HIV treatments with medications. That's the functionality, the functional side of it. Once you have this, then you can start exploring the technical side of it. But FHIR does provide kind of a more friendly way than before to start exploring those questions. So FHIR does give you some increasing, and so increasingly FHIR and the FHIR publications and the FHIR ecosystem that we are developing, FHIR does give you a very good input into starting quicker from the business and making it more and more going down the technical side. So this is something I wanted to mention, and I apologize for my background symphony that I cannot switch off. And I wanted to address now the question of the privacy and security and data sharing. So data sharing is actually one of the things that FHIR has all the tools to allow us to excel, because so security and privacy, they do come together, of course, but it's really hard to have, first of all, one flavor that meets everyone's needs. And it's really, I'm really sorry that I have to. I don't have a moment of solace now to just resolve this situation. So FHIR does have the mechanisms for security and privacy in it, some of them. It doesn't mean that there's a one formula that meets that fits everything, but when you do privacy, you cannot do privacy without security. So maybe I'll just look into the security and privacy page. And I will just see where it is. So let's go a bit into those details. security is about how do you protect your data? How do you tag your data for it to be protected? So and FHIR is all about data exchange. So when we talk about exchanging data, how can we make sure that that exchange of data is secure? FHIR in its core does provide some mechanisms for that. So it provides some guidance on this kind of encryption. Can you do this? Can you do some security tags? So there's a couple of mechanisms that are built into FHIR that allow us to do this. For example, signatures for verifying the authenticity of the content of a data exchange. There is things like logging and tracking who has that information. I'm sorry, I'm just trying to avoid an accident here. So the information that you exchange has to be protected, as we know. So there's lots of mechanisms for that, encryption, etc. This is something that we can do. FHIR also allows us to tag the information in the so that we can actually have some computable guidelines behind that. So, and I'm going to explain what I mean. If I send data to someone else, I would like that person to know in a computable manner, and FHIR is really good at that, to say you can use this data, but only for this amount of time, or only for those purposes, or please destroy after use. So you can send these labels. You have these mechanisms in FHIR already. We also have mechanisms to say, from the moment that I access the data, I want to track, or I want the system is tracking that I'm accessing that data, so that if someone wants to audit what has happened where, they can do it. So FHIR does also have those mechanisms. So it has a resource called audit event that does those things. When I get the data, FHIR also has a mechanism to say, whence did I get this data arrive here? If I, as a patient, I give my consent to sharing data, or the same way that I give my consent to go under surgery or to have my organs removed, etc. FHIR, so now talking about privacy, there is a consent resource. And these are FHIR resources, which means, as you can expect, these are standard ways of exchanging data. So if I say two systems will do their audit event, so two systems will track whoever touches the data, if that's the policy. So if those systems want to do it, if they do it in a FHIR standard way, then the good thing is that I can look at the audit events from one system, the audit events from the other system, and I will understand what they mean because I know they are a standard format. There's a couple of, and I think this is just also how you navigate into the FHIR specification. You go into the key topics, and then you see what resources are applicable, and then there's always lots of information that help you set up or see what is in scope, what is out of scope, how can you implement this. That's one thing. The other thing next to this, for those of you that are not familiar, there are FHIR implementation guides that build on the FHIR specification and provide a concrete implementation guidance on how to do some things. So there are implementation guides on different topics, and those are very useful to produce. For example, we are working on implementation guides for HIV case reporting. So we take the FHIR, the specification as it is, and we add, or we make it, we tailor it so that it fits specific purpose. So yeah, so there's lots of guidance around FHIR, but it all starts with these technical standards. I hope it was okay for the first introduction on privacy and security. I would say go there. There's lots of materials out there around privacy and security. If you search YouTube and blog post, you will definitely find some materials. Now I need to catch some breath, but I would like to have more questions. Or Rhonda, I don't know if Ditwan, I lost track of the questions in the chat. If you could help me recap those to see if there's any open topics now.
There is one. It is from Izar. Nope, sorry. From Wendy. Sorry about that. Could you talk about how FHIR works in these types of settings? They were told that they use Frontera and PHP backend. You were told that it may be a difficult approach for FHIR interoperability with this. Do you know how those work in LMIC settings? Unless I got that question wrong, Wendy, please do.
It's the last one that we see there, right?
Yes.
If I do not know Elm, I can look it up in a second. But if if JS means JavaScript, that's one of the things that we have. So there are JavaScript libraries for FHIR that can help you your developers use FHIR. And if you have PHP as a backend, well, then maybe you don't need to have all that PHP on your backend if you want to pass it to convert it to FHIR. Or maybe you keep your client and you kind of force your PHP to produce FHIR results, depending on your systems. Maybe, Wendy, do you want to explain? Or what is your system about? Concrete.
I'm sorry, I didn't quite get the question, but just to give a little background. So we have a front end that is using Elm, which is a form of JavaScript, is my understanding. And then there's a RESTful API to connect to the backend, which is Drupal. And we're also trying to figure out, is the backend, do we need to adjust the backend to maybe a FHIR server instead? But we were told that the PHP, that will be challenging to make interoperable with FHIR. But we're happy to build, we want to think about, what does that mean? Do we need to build something to create that interoperability layer? Or should we be thinking about a different backend? And I hope that's a coherent question.
Sorry, I have a sick child at home. That was a really unexpected thing, and she woke up just on time to make some noise for the session today. So concretely, so if you have already a backend, and if you think that, okay, we need to use FHIR, first of all, there should be a business purpose behind this. I mean, if something is working, then it's working. But however, if you want to expand further, if you want to make it work for other systems, for other things, and you want to give it a FHIR flavor, there's nothing preventing you from doing that. So when you say, however, that I have an implementation, so we have an implementation in PHP, most likely that means that you already have your data models. So that might actually be the object. So it's not it's not the problem of having this or that technology. It's more the problem that if you have this already, then it means that you already have implemented some data models. And FHIR, so basically what FHIR does is tells you is to say, oh, here, for example, let's take a patient. This is the patient definition, but I'm going to share one example of a patient. So if you want to exchange patient information, this is how it looks like. It starts like this because that's the FHIR syntax. It has an ID, and it may or may not have an identifier. It may or not have a status active, and it's a patient, so it may or not have one or more names. This is the model, and this is a very formal model that is defined for patient, which is actually defined here. So this is where we see that the patient may have one or more identifiers, has an active, and may have one or more names. This is the structure that FHIR has. If you can do this, so if you can produce this with your PHP backend, or if you can consume it with your JavaScript frontend, you're fine. That's pretty much it. There are a few things like so you have to produce this kind of content. There's also a few technical things that you should do if you do a server, but doing a client, for example. As long as you comply with this information, then that's it. So as long as you can consume or produce these data objects with this data definition, you're fine. How do you do that? There is the process of defining your own specifications. Please look up the videos on FHIR, customizing your FHIR or adapting FHIR to your purpose. I think it was our second webinar, so around May 2021. Please check those webinars if you want to get more into that. But yeah, so in a overly simple answer, as long as you can consume these data objects and you can produce these data objects, if that's depending on where you are on your stack, then you're good to use FHIR. In fact, if you have a project or a program to implement something, you might as well not rediscuss what patient means and just use this off the shelf. Just take this model and say, well, if this works for most of the world, maybe it works. Maybe we make it work for us, because most of the things are there. What about patient first name and last name? Is it really first name and last name? Because if you go to the other side of the world, then it's not really first name and last name. It's last name first and then first. So it's family name first. So it's better to call it family name and given name and not first name and last name. So all these questions, they are prepackaged for you, all the best practices that come with it, all the things with security that that some elements have to be there. And if you want to for example, keep audit of who accessed it, so these behaviors are defined. So the data structure and behaviors, if you can do them with your own backend, go ahead. Nothing should ever prevent you from doing that. On the client side, of course, it's more easy, because normally the client side is just collecting information, just consuming data. The backend might have a bit more of technology complications. And if you have already something that works, then good. If you don't have it, then one of the things that we can recommend, my starting point is say, well, then I'm going to launch an existing FHIR server, so the HAPI server, and then I will connect that to my database as to make the whole front end. So there's a couple of videos there on FHIR for architecture, which explain exactly that. So if I have my backend, nothing prevents me from putting FHIR in front of this, so that I can say, well, behind this wall, everything is still my old data model and my old syntax. But after this, I'm going to add the FHIR layer on this. And there are solutions out there, several servers that allow you to do just that. So you make a front end or a kind of a facade in front of your backend and say this part talks FHIR, while the rest behind it, we don't know. We don't have to touch it. I mean, the outside applications don't have to touch it. That becomes, let's say, the team that manages their server, they keep doing it in whatever technologies, but they just have a new facade, a new exposure point that is FHIR compliant, and the servers are also supportive of that. So directly addressing the question, so that you were told that it's difficult once to migrate to FHIR. Not really. The difficult part, I think, will be if you have to redefine your business purpose, your business roles, your business processes, and your data objects. That is a tricky part, because adopting a FHIR layer on top of what you have should not be so hard. Of course, if the objects are different, so if your patient definition is different, then you have to go through a bit of redevelopment exercise or reevaluation. But it's not the hardest work. The hardest work is, and this is again my experience, the hardest work is actually knowing what to do. And FHIR does save a lot of that, because it says, here's a standard model for patients. If you know what you have and you know what you have to do, like if you know what you have now, and if you know that in FHIR you get 80% of what you should be doing, if you keep that rule of thumb, then you already saved a lot of analysis, business analysis and functional analysis time. I don't know if this helps in your endeavor.
Looks like it does help, but we have another question, which I think will have a similar answer. What about React on the front end and Node.js on the back end?
Go nuts
with FHIR.
Go nuts. So really go. So it's again, if you have any JavaScript technology, you're just consuming JavaScript objects. I was a few days ago, I was just making my own simple dummy application for whatever purpose. I really don't remember. I just wanted to show some things, and I did not want to show people JSON files and XML files. I just wanted to show people something a bit more humane. And I just did a small client in Bootstrap, and so and I don't master the JavaScript world. So if you have a technology framework that says I can make applications with it, what FHIR does is to allow you, especially if you're talking about RESTful FHIR, is to say, if you make this request, you'll get this object, and that's it. And these are the rules for this object, and that's it. Of course, and it does provide you some tools, like if you want to see if your object is really valid across, according to FHIR, before posting it, you have this option. For example, the many servers have a validation option that if you put the content in, you say, hey, dear server, please check if this is valid before accepting. You can do this, but it's just an exchange of RESTful. So in this case, it's just an exchange of RESTful interactions. So go nuts, use whatever language you have. As long you can do Python, I do a lot of Python scripting. As long as you can do a request to the server, and if you're interested in the result, whatever language you use, that's fine. You can use Visual Basic if you want. That last thing with a grain of salt, what I just said now about Visual Basic. You can, but be careful. If this helps.
Any other questions, folks? I don't see anything in the Google Doc either, so. Wait.
So I'm one of the things that interests me the most is how, as I said, how we as technologies can connect more to the to making things effective and useful. So we are as we go and support different projects, we are trying to set up a kind of a knowledge base and the tooling as well, so that we have, for example, ways to put FHIR, or standard ways to put FHIR in an architecture discussion, because it's hard. So sometimes you have architectural discussions and someone brings up the FHIR word, and there's what are we talking about? We were talking about medications and now we're talking about technology. That's hard. And while those dialogues, they are always there, I think it's there are some initiatives that we are developing. And to be short, and I apologize for that, stay tuned, look at the webinars. We're trying to provide more and more ready and out of the box solutions, so that if you want to do, for example, case reporting. Well, what is case reporting? Look at the webinar, see, well, case reporting is about data entry in one or another way, and then using that data for analytics, for example, or for triggering alerts about patients. So if you have what I just said is hopefully more of a business language than just saying you have a subscriptions mechanism and you have a questionnaire. This is how it's done. But what is it going to be used for? So capturing data on the field about an HIV patient, or collecting existing patients from the central server so that you don't have to ask people in the field to re-enter patient data. So those things are what we are also working on. So we are trying to build up the FHIR ecosystem so that not only you have a technical standard, but you have kind of pre-packed solutions. And here I enter with the work that we are doing with OpenHIE, with IHE, so with several institutions that want to provide kind of canned solutions, kind of pre-packed solutions that say, if you need to have case surveillance, you will always have your flavor, but if you start with this, you already have a very good vanilla base. And I think that's also something that we are doing in terms of pre-packed solutions, and especially the business engagement. So while I cannot guess what was I think it was Wendy that asked about so we're that is starting a program. While there's no ready-made solution, if I don't know the question, the topic of the question, or the specific clinical context, that engagement between clinical and the technology side, we are hoping that FHIR helps us a lot in closing that bridge. And I'll just launch a few teasers here. First of all, by having and this is something that we always do. You can look in our webinars. We made a small example on food allergies, by having non-technically focused but functionally focused data models, so abstract data models. If I can talk to a physician about, for example, does the allergy substance, so when I report an allergy, do I have to say what is the allergy about? The clinician will normally say yes, sure, even if you just suspect that's the thing. But the one thing that you have to do is to say what is the allergy about. I may not have to say the date when the patient became allergic, because I might not know that, but the thing that you're allergic to, sure. And those dialogues, if you talk about those things in non-technical terms, I think it really, really helps. So FHIR, we are working to make FHIR more business friendly in that sense, in the sense of having that kind of dialogue supported and specified, so that when we capture our data models, that's our functional data models, and then the technologists do whatever they want with it. But then we are making the ping pong between the functional and technical a bit easier. So that's one thing. The other thing is really important, is that the way that we are doing the FHIR tooling, we have a lot of investment in terms of community commitment to agility, to agile development, which means that, as I said before, we can roll out a prototype server in a short amount of time. And that's not something that the value of that, it's not that it's technically cool, it's that you save so much time. For those of you who have been promoting agility in your projects, the fact that you can show the results very quickly to the people that are making the requirements, that's extremely powerful. And FHIR is really helpful of that. For example, the prototype that I was doing, I want people to see what they are being requesting, because actually in that case, I had the feeling that the requirement was not clear, but I wanted to show what I understood, so that if they validate it, if they look at what I understood, they can immediately validate it from a clinical perspective. That I could only do by setting up a small client, so a server I already had, and a small client for FHIR. And FHIR does allow this very quick agility of this very quick turnaround. So approaching the business modeling, that's one side, and providing very quick feedback, very quick implementations, and very quick iteration. That is one of the things that I really like about FHIR, and that's something that maybe we can explore in further discussions. So that's something that should help in the business engagement, I hope. I don't know if that helps. Wendy, I think your question was triggering my brief dissertation now. I don't know if that is helpful for you.
It's incredibly helpful. Thank you. I'm taking frantic notes, and I'll be watching the webinars, but this is so helpful. Thank you.
Just as a teaser, the best way to take those frantic notes, or to catch up on those at any time, reach out on chat.fhir.org. You can find me there, most likely more hours in the day than I should. But do reach out to me or to anyone else. It's really an interesting community, and you have people that are really into the weeds of technology, and people that really come with a mission, but they have no idea what the technology is going to do for them. And to be honest, if I were in that position, I would say, I don't care about technology. That's your problem. I mean, if I were talking to myself, to another me, I would say, it's your problem. Fix it. You're the technologist. I have a clinical problem. And I think that all those perspectives are accepted. So please reach out in chat.fhir.org or in any way that you want, and yeah, let us know what you're up to. Most ideas come with a bit of a context, and then we can have some fun in discussing those.
You described our experience perfectly, because I'm a physician, and so that's the usual conversation. This is what I want. Let's make it happen. But
I feel your pain. Actually, the discussion I had was also with the physician, and I can tell you. So one of the projects that I was first doing many years ago, way before FHIR, and way before I had the technologies that we have with FHIR, I had a lot of effort to say, dear doctors, this is what you are going to get. Are you happy with it? And there was lots of mocking up and playing around and I did simulations and emulation. I did a lot of work as a technologist just to validate my design, which, by the way, it's actually a formal step when you make a medical device, and software maybe, I don't know if it is, but maybe a medical device. The step of design validation is formally recognized in this important step, which is before you actually make the system, see if this is actually what you want. See if by doing this, you're not causing more harm than good. See if by doing this, you're not exposing the patient to risks, being it safety risks or privacy risks. And this iteration is really, really important. So my best recommendation is make sure that the technologies follow the clinics and the clinicians and not the other way around, which is a tough fight. We always get dragged into the black hole of technology, but make sure that you demand, prototypes and ideas to be materialized somehow before you actually implement things, or as you implement them, because the path to implementation is rather quick. But use and abuse the ability of FHIR to prototype. You can quote me and say, well, if that crazy guy can do a server in 10 minutes, why can my not developers do it in 15 minutes? And give them something, and then they will let them come to me and they say, oh, how can you make a server in 15 minutes? Very crazy. That, yeah, I'm crazy, and here's how you do it. Please reach out and yeah, keep us focusing on what matters, not technology. So actually helping the clinical perspective of it.
Thank you. This is so, I should give our developers credit that they really control themselves to this, but I think we would love to be a part of this community. So thank you for this.
Keep joining and just reach out. That's what we're here for. Well, we are on time because I had to step aside a bit. I think we should be right, yeah, at the top of the hour. Is there anything that we should look into or prepare or tease for the next sessions in 2 minutes? Does anyone have anything to say, request, complain in these last few minutes? Well, if not, Vrunda, are we good to wrap up the session?
We are. One quick question. How can we reach out to you for a question, Jose?
Chat.fhir.org.
He is there often. I will. I'll just say thank you, everyone, for joining us. Our next webinar is on June 15th, I believe, on layering and reusing FHIR implementation guides. So we hope to see you there. It's just through the registration link in the chat. And you are, yeah, let me know if you have any trouble finding any of our old webinars. I'm happy to point you in the right direction. Thank you so much for coming, everyone. Have a great remainder of your day.
Thank you very much, and thank you for your patience in understanding my babysitting situation.